Hi, this presentation will be on HIV, but today I will limit myself to prevention only. And it's a common saying that prevention is cheaper than cure. Actually, it saves lives. Before going to prevention, we need to know some basic things about HIV because if you don't know what you want to prevent and how you prevent it, it will not make much sense. So I think every educated person worldwide now would have known something about HIV. How could we get HIV infection? We get it through vaginal fluid, semen, and by saying that, you understand what I'm trying to talk about. Blood transfusion, IV drug using and sharing needles, sharp objects, needle pricks, breast milk, saliva, intrauterine, that is vertical transmission, intrapartum or breastfeeding, rectum, because semen and blood could be there. There are some prophylaxis, and now we have what they call pre-exposure prophylaxis. I'll talk more about that in a bit. And we also have post-exposure prophylaxis. I will not go into that right now. I will handle that later on. And of course, antiretroviral therapy for those that have already been diagnosed and now taking treatment. It's no longer prophylaxis at that stage. The pre-exposure prophylaxis, we have a medication manufactured for that purpose right now. It's called Truvada. The first thing to do before you start taking this medication is get yourself screened. Because if you are already infected, there's another route to go. But if you are not infected, great. Truvada is okay for you. If you don't want to take any medication because of the side effects, because I'll go into side effects of Truvada in a bit, abstinence is the best and is 100% safe. No side effects. However, if that is impossible, like, especially so, and you're at risk, or you're engaging in risky behaviors, so use condoms. But now the big question is, don't you like condoms? And the answer is, no, I don't. Then you better look for Truvada. Talk about that with your doctor. And if you can combine Truvada with condom, great. What are the side effects of this pre-exposure medication? With nausea, vomiting, and diarrhea affecting the gastrointestinal tract. Your appetite could reduce. You have headaches and rashes, weakness, and maybe renal failure, and it affects your liver. Also, pancreatitis. Truvada is a combination of emtricitabine and tenofovir, and that they are both collectively called nucleoside reverse transcriptase inhibitors. It's a group. By the time we start the treatment of HIV fully, I will now make presentation on the different classes of antiretroviral drugs. So you take one tab once daily. But if you have HIV already, you better contact your doctor because you might need more meds called highly active antiretroviral therapy. And citrabine and tenofovir could be included, but will not be limited to Truvada once you are diagnosed with HIV. What are the risk factors for HIV? HIV is worldwide. It's not a local problem anymore in any society or race. There's no racial predilection, but it may be common among more race than the other ones. It's fun in any age right now because if you say, okay, a child will not indulge in this and that, I'm fine. How about intrauterine from the mom? How about during labor, breastfeeding, and adolescents that are active sexually and you understand what I'm talking about, and adults, elderly, it's just everybody. And no gender predilection, male and female, although some more than the other ones, but I just want this presentation to be for everybody. People who take blood transfusion, but unfortunately not properly screened because that's what they call window period when the viral load might not be peaked, the antibody titer might not be that significant to give a clue that there's HIV infection going on in this patient and the blood is already transfused and so on and so forth. Sexual contacts, you know what I'm talking about, multiple partners, anal, more than vagina. I mean that people contract the HIV more when indulged in anal sex than the vagina. Any open wound in affected person, any blood, any fluid from affected person could transmit it. Needle puncture or needle sticking, needle pricks and so on and so forth. How then could we prevent this deadly disease? Affected people to please help the rest in the country or in the community by disclosing to maybe the government or to their family members or to their partners. Please do. Abstinence is the best, but now I don't want to go into anything more than this presentation. Use condoms. Screen blood before transfusion. Well, in advanced country, that is rare. And in so many other parts of the country where people just grab anything, I mean, different parts of the world rather, where people just grab anything and just place anything off and just, oh, please, please. Truvada is available right now. Discuss with your doctor. Stop doing drugs. Because if you stop doing drugs, you stop sharing needles. That's another common way of getting HIV. Decrease transmission in pregnancy by getting treated while pregnant. There's no shame there. Your doctors and nurses are good people. They're going to keep your secret confidential. So they're not going to disclose unnecessarily except your partner because you need to help your partner. So you are pregnant, you are HIV positive, there are antiretrovirals you could take that will help you and your baby. Please get treated. To those who are not circumcised, I'm not blaming you for religious reasons or for personal belief or whatever, but if you can keep it clean, fine. If not, if you want my circumcision could help. In conclusion, please be vigilant. Protect yourself, particularly healthcare workers. Be safe. If you have the virus, please, for the sake of humanity and generations to come, disclose your partners. The next presentation on HIV will be clinical futures. Thank you.